Tips for preparing a responsive letter of intent, or LOI. PCORI is an important part of the country's research enterprise, and people are increasingly turning to PCORI for funding for patient-centered comparative clinical effectiveness research, or CER. PCORI staff are always available to help with any questions an applicant or prospective applicant might have. In the meantime, here are some tips on developing a responsive letter of intent, or LOI, to get you started in the process of applying for PCORI funding. Tip 1. Understand why an LOI is required. Submitting an LOI is the first stage in a two-stage process to receive a PCORI funding award. Unlike some other CER funders, PCORI requires organizations to submit an LOI before they can be invited to submit a full application. Each funding opportunity is presented in a PCORI Funding Announcement, or PFA, which clearly outlines requirements and expectations. Funding announcements may focus on a variety of topics, conditions, and populations. Pro tip: the best way to ensure your LOI is responsive is to carefully follow the instructions of the PFA. PFA requirements and templates may change from one funding cycle to another, so be sure to confirm you are submitting to the most current version of a PFA. Tip 2. Select the optimal PCORI research funding announcement. PCORI funds research projects that answer patient-centered questions about health and healthcare. PCORI seeks to fund CER projects that compare the effectiveness of two or more interventions or approaches to healthcare, examining their risks and benefits. CER findings assist clinicians, patients, and other members of the healthcare community in making informed decisions that improve healthcare. PCORI does not fund studies focused on developing and validating instruments, such as surveys or scales, testing or validating new tools or decision aids, studies designed to test the efficacy of unproven interventions, or pilot studies intended to inform larger efforts. PCORI also does not fund cost-effective analyses or studies that focus on the relative costs of care as the primary criterion for choosing between alternatives, or research comparing patient characteristics rather than clinical strategy options. Lastly, keep in mind that PCORI does not fund proposals that do not include patients or other members of the healthcare community throughout the research process. Pro tip: explore PCORI.org to better understand what is already being funded to ensure your particular study idea or question is not currently funded. Tip 3. Describe all components in the LOI. Each PFA includes an LOI template. You are encouraged to work with your team to describe all of the LOI components in as much detail as possible. Examples of LOI components include research question and background, study population and research setting or settings, comparators, outcomes, study design, sample size, power, and analytic plan, engagement approach, duration and total direct costs, and references. Pro tip: LOIs are submitted online by completing the required LOI fields for the PFA and uploading the completed PFA-specific LOI template into the system. Tip 4. Make use of PCORI resources. For applicants who have questions about the LOI process, there are a wealth of resources available. Be sure to look for PFA pre-announcement listings. PCORI publicizes each funding opportunity via pre-announcements in advance of the official release date to provide potential applicants with additional time to prepare, identify potential collaborators, and obtain input from relative community members on proposed study ideas. You should also consider attending a town hall to learn more directly from PCORI staff and benefit from the questions and thoughts of other prospective applicants. If you need a bit more information to get started, try reading PCORI's frequently asked questions and other resources on PCORI.org. At any given time, you can browse our repository of all past, present, and upcoming funding opportunities, or take advantage of our website's search function with highly customizable settings to find exactly what you're looking for. Pro tip: Even if you don't have specific questions in mind, engaging with the PCORI resources at your disposal can help you write your best LOI and maybe answer questions you didn't even know you had. Tip 5. Reach out to us. Applicants and prospective applicants are encouraged to get in contact with PCORI staff for help with the process, whether they receive an award in a particular cycle or not. PCORI exists to advance patient-centered CER, and PCORI staff are encouraged to support and collaborate with researchers, patients, and others who are making this work happen. Pro tip: engage early and often. Contact PCORI staff before you submit, if your LOI is accepted, or if your LOI is not accepted.